This is Drive with Anna Vito on ABC Radio Canberra.
Late last week, the federal government announced some new spending caps for the NDIS. The Prime Minister has said that the current scheme is growing at around 14% a year, and he says that's unsustainable. He wants to set what's the government's calling an annual growth cap of 8% on NDIS spending, the size of the NDIS. And all of this following hot on the heels of a major address at the National Press Club by the Federal Disability Minister, Bill Shorten, outlining his plans for a reboot of the scheme. He described that as not being a slash and burn of the NDIS. But this news of a cap on growth of the scheme has been greeted, I have to say, angrily by many disability advocates, and it certainly drew the ire of Advocacy for Inclusion's head of policy, Craig Wallace, who spoke to Lish about it all this morning.
An arbitrary cap, and that's effectively what a growth target is, takes us right back to the kinds of rationed disability support system that we had in the past, and is really a change in direction and tone, and it blindsided us, and it also seems to have actually surprised the disability ministers themselves.
Well, let's ask. Joining me in the studio is the ACT's Disability Minister, Emma Davidson. Minister, thanks very much for your time.
Good afternoon, thank you.
Were you indeed, as Craig Wallace put it, blindsided, surprised by that announcement on Friday?
I was really surprised by the announcement. The reason being that we've been talking for months now at the meetings of disability ministers about how we make sure that the NDIS is achieving those objectives about choice and control for people with disability to live a good life. And we've been talking about some of the gaps in the NDIS and some of the pressures that creates on where people can get access to services and where they can't, and how we can work together to meet those needs. Now, that actually is a conversation that needs to continue. And when we're seeing National Cabinet come out and talk about arbitrary figures for the financing of these things without having the conversation about how we actually meet people's needs, that's a real worry.
Is it arbitrary? Do you know where this 8% figure came from?
No, it wasn't something that was discussed with us in detail beforehand. Now, one of the really important things to think about the NDIS is how we make sure that we're meeting people's actual needs, because if their needs aren't being met by the NDIS, those needs don't go away. They're still going to need health and social services to be able to live a good life. This is why the NDIS was created in the first place, and it's why the original plan for creating the NDIS was done with people with disability, because they actually know what kind of things they need and what's going to work and what isn't.
Do you share the federal government's view that the scheme, as it's currently growing, is unsustainable?
Look, everyone in the community absolutely agrees that the NDIS, as it is now, does need some major changes to make sure that it's achieving its objectives.
But is it unsustainable in your view?
I think that we really need to make sure that we're meeting people's needs. And at the moment, there's a whole lot of people whose needs aren't being met by the NDIS in its current state. You can see that through the number of people who've ended up having to appeal decisions to the AAT, or people who were staying in hospital for too long and not able to get home sooner. So we've been working on some of those things, but we also really need to work on how we make sure that we have access to things like early childhood development services or psychosocial mental health supports that the NDIS has not been able to meet. And there are ways of doing that, and we've been trying to do that here in the ACT. We'd really like to work with the Commonwealth to make sure that we can do that everywhere in Australia.
Does that mean, I suppose, because the NDIS is a demand-driven service, that's the point of this, is to make sure that people who need them get the supports and the assistance they need to live full and dignified and, fulfilling lives. Does that mean that any kind of cap on growth of the scheme would be inappropriate in your view?
It means that we have to talk about how we're actually going to achieve those objectives of the NDIS and not just be talking about arbitrary figures without any context for what does that actually mean for people getting access to the things they need.
So when you were talking then about it's clear that there needs to be change in some areas. What are those areas?
So this is why we have the NDIS review going on right now that is co-chaired by Lisa Paul and Bruce Bonahady, who are absolute experts in understanding this work and have been working with people with disability in the community to understand what are the structural barriers that exist in the NDIS and how can we make it work better. Now, one of the things that we've been hearing from people in terms of, where the gaps are and what they can't get access to is things like early childhood development supports for young children who might be neurodivergent or have developmental delays and maybe don't even have a diagnosis yet. Now, these are people who aren't going to be getting an NDIS plan, but at the moment the pressure has been there to go out and get NDIS plans so that you can get access to services. What the ACT government has done in the last budget is funded some of these early childhood services so that people can get access to the things that they need for their children without having to go through that whole NDIS process. All of these things are really important in how the impact that they have on those demand drivers that you were talking about. This absolutely is a demand-driven system. And to just be talking about numbers without talking about what people need to do in order to get access to the supports they need is not actually going to be workable in the long term. And we want this to work long term.
Talking about the ACT government and what you're doing, I wonder, is there scope for the states and territories to do more? Because it would seem that the federal government believes there is. If we look at Bill Shorten's speech at the press club the other day, he was talking about the fact that the federal government has made progress on bed block, has managed to move more people out of hospital who should not be in hospital into different places instead. And he's talked about the costs that then would free up for state and territory governments who obviously have to worry about that sort of end of payment. He talked about a major reboot of the scheme. We know that there are these gaps, people who don't qualify for NDIS, which can mean they're facing a wasteland rather than supports that exist outside the NDIS. Is there scope, capacity for the states and territories to shoulder more of the cost of the NDIS to ensure that those needs remain met? Or does it need to be the federal government who is finding the increasing amount of money as it goes along?
So some of this is about the way the NDIS is structured and its focus on, individualised payments for individual services, units of service. And actually, we know that some of the services that people have been asking us for and have been saying really help them achieve the outcomes they want for their life are actually best funded through sort of group therapy arrangements or block funded services where it's not actually down to individual user payments. These are the kinds of services that the ACT government has funded in the last budget. For example, dialectical behaviour therapy programs for people with psychosocial mental health conditions or early childhood development services for people who don't have a diagnosis yet. These are the kinds of things that we know help people get those outcomes. And I've talked about this to Minister Shorten to let him know, hey, the ACT is working on this. We're really keen to work with you to better understand how we can make all of this fit together. What we all want is a really well-integrated health and social services system between both Commonwealth-funded and state-funded services that meets the totality of people's needs for their life.
And so to achieve that, is it the ACT government's view at the moment that is shared well and fairly between the federal government and the states and territories, that the balance of who's responsible for what is about right at the moment, or do you think that needs to change?
Some of the difficulty actually is that we've got Commonwealth departments out there working away on the things that are Commonwealth funded. We've got ACT directorates who are working away on the things that are funded at the ACT government level. And we actually want more conversation flowing between all of these different areas and with people with disability and their carers to better understand how we can make it all fit together better. So, better collaboration, all of us working all in together. That's what's actually going to give us a great system, and that is what people with disability need and deserve to have. Better integrated services where the whole of their needs can be understood and met.
So where does that leave leave things at the moment then, Emma Davidson, as the Disability Minister here in the ACT with us on ABC Radio Canberra. Have you managed to speak with Bill Shorten? We're still waiting for this big review in the NDIS to come in to the end of the year. Where does all of this leave us on ensuring the NDIS is delivering on its promise?
Yeah, I have spoken to Bill Shorten. I've made it very clear what my views are and what it is that I'm most concerned about. I've also had those conversations and passed on that information to the Chief Minister. And what I'm really keen for is to make sure that we get people back and talking to each other again about how do we best meet people's needs. What we want is to make sure that people with disability don't end up going with their needs unmet.
How far away are we from that now, do you think?
I do think that we had been making some really good progress in talking about, what are some of the early findings from the NDIS review, what's the direction that things need to be headed in, and sharing what we've learned in the ACT, having been partners in the NDIS with Commonwealth for longer than any of the other states, about what works, what doesn't, and what we've had to fund out of the ACT budget most recently to make sure that people's needs are being met into the future. And I'd really like to continue those conversations.
Emma Davidson, thank you.
Thank you.
It's the ACT Minister for Disability, Emma Davidson, with us on ABC Radio.